Synthetic hormones have become a very common option for contraception and boosting deficient hormones. You may be taking or have taken synthetic hormones and experience positive, negative, or questionable symptoms. As with most things, there are pros and cons to taking synthetic hormones. Let's review these so you can make fully informed decisions as to what is best for you, your goals, and your health. First, hormonal birth control. Hormonal contraceptive use has been increasing worldwide. In 2019, approximately 1.1 billion women of reproductive age were in need of family planning services worldwide, with almost 50% of those women using various hormonal contraceptive methods, including either estrogen and progesterone or progesterone only. First, let's talk about the cons of hormonal birth control. The use of this method has been associated with either reduced or increased risk of many adverse health outcomes, including cancer, cardiovascular disease, fracture, gastrointestinal, and metabolic outcomes. These risks vary depending on the dose, route, duration of use, and formulations of the hormonal birth control agents. As a registered dietitian, some of the most common impacts of birth control I've seen are onset of gastrointestinal issues, nutrient deficiencies, and impact on mood. In fact, research has shown that women taking hormonal contraceptives were 50% more likely to be diagnosed with depression 6 months later compared with women who were not prescribed hormonal birth control. In fact, research has shown that women taking hormonal contraceptives were 50% more likely to be diagnosed with depression 6 months later compared with women who were not prescribed hormonal birth control. This is especially impactful on mood and depression rates in teenagers, who are commonly prescribed birth control instead of supporting effective lifestyle changes. Now let's talk about pros of this method. Hormonal birth control is a relatively simple form of contraception, which is why it's so popular, and may help reduce symptoms in some diagnosed with depression, anxiety, and crippling menstrual symptoms. If you have been experiencing negative symptoms associated with birth control, but contraception is important to you, check out our video on the fertility awareness method. Now let's talk through testosterone in synthetic form. Here are some of the cons. Studies revealed potential risks, particularly to risk of heart attack and stroke. Once supplementing, your body reduces its own testosterone production. Now to the pros. Men with very low testosterone have a higher chance of developing heart disease, osteoporosis, and other problems if they go untreated. Men supplementing with testosterone can experience increased libido and energy levels. So let's go to the bottom line. Only consider supplemental testosterone if it's low and check in frequently with your physician to test your levels. Also consider that consistent strength training and other lifestyle changes can help boost testosterone levels naturally. Now let's talk a little bit about testosterone supplementation for women. The hormone testosterone may boost sex drive for some women after menopause, but there's little research on how safe it is and how well it works over the long term. It can also cause side effects like acne, hair growth on the face and body, hair loss on the head, and weight gain. Synthetic hormones do come with benefits, but as with any medication, also the risk of side effects. Always seek information from your practitioner on all possible side effects of a medication, and consider that, although typically a slower change, nutrition, activity, and lifestyle improvements are effective with no risk of side effects.